Hello, 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 YouTube world. It's Miss Patty with For Your CNA, and we are here for our twice a month CNA practice test game show. Hey, Blue! Oh my gosh, I haven't seen you in forever. I'm so glad you joined. So today, we're going to have the game show. We're going to do 15 questions that are very similar to what you would see on the state exam. And today's questions are actually going to come from this section right here, which is section 1 of the test plan that covers the role of the nurse aide. But specifically, this is going to be from the area titled, and I can't, nurse aide as a member of the healthcare team. Sorry, my eyes are not as good as they used to be. So this is going to focus on things like being part of the team, collaboration, teamwork, understanding your role, following the care plan, those types of topics. And this is going to make up about 20%. This whole category makes up about 20% of your written exam. So this is a pretty big one. Yeah, Blue, I know I miss Thursdays too. I am so swamped right now. For those of you that don't know, I actually went back to school for marketing. So I am actually taking a program to learn how to market effectively. And I'm getting lots of certifications in marketing, and it's really, really kicking my butt. So when when I was preparing this for you today, I was thinking to myself, oh my goodness, if I just had something like this to practice for that certification exam, it would be so helpful. But unfortunately, there isn't anything out there, so I'm going to have to kind of struggle through this myself. But believe it or not, I'm actually using the same platform that I'm using for you guys. I'm using it to create my own study cards, my own study questions, so I can quiz myself as well. And it actually is turning out to be a pretty effective study method. So pretty cool. So yes, Blue, it is to help market my school and business and a couple of other marketing for some other purposes as well, but primarily for what we do. Yes, we need to tell everybody about what we have to offer. And in my experience, it's always better to rely on myself to do tasks because not everybody else sees my vision. So let's see who's here. Good morning, Kubra and Anna. Good morning, Kyle. Good morning, Kanisha. Good morning, Maureen. Good morning. Let's see here. Maureen says, I passed my CNA exam yesterday thanks to your videos. Oh, congratulations. That is amazing. Great job. I'm so proud of you. Good morning, Guerline. Blue says, one of the RNs I work with took a consumer buying behavior class as part of her 4-year degree. She didn't understand how it related to medicine, but holy cow, she learned out. Yeah, absolutely. Absolutely. It is so tied in. And remember that healthcare is a customer service, and you're actually going to see a question on that in just a few minutes. So we do need to understand customers and consumers and what they expect and how to approach them as well. So that's actually a very, very important part of what we do. So Ashley, good morning. I'm studying now so I can take my test. Awesome. So let's get started. All right. So pregame rules. You guys, most of you have been here before. You know how this runs. But each question is going to be displayed on the screen for about 60 seconds. You're going to type your answer in the chat, 1, 2, 3, or 4, based on the answer that you wish to choose. Now, be careful here because the system that I'm using to grade these answers will only accept your first one. That's it, just your first answer. So don't be too quick, but speed does count. So the first person to get the right answer gets the most points. So you do want to be a little bit speedy, but pay attention to the question because you can't change your answer and get points for it. I hope that helps. So as always, we are competing for prizes because what game show is a game show without prizes, right? So you have an opportunity to win prizes just by answering questions. In first place is going to be the CNA card game, which helps you practice for the state exam. It has lots of information on each card, but it can also be played by people that aren't in healthcare. So family and friends are going to play it as a rummy style game. So you can concentrate on the content of the cards. They're going to concentrate on the cards themselves. So it's a great way of getting your friends and family involved in the fun. But it's going to teach you along the way. And there's a lot of strategy to this, a lot of strategy. So it becomes an actually fun game to play outside of healthcare. So the CNA card game is first place. Now, please remember that prizes are limited to those in the United States. I'm not set up for international shipping. So if you're an international person, you're more than welcome to compete and play. We just won't be able to ship your prize to you. You can donate your prize if you wish, though. Second place is the CNA, for your CNA badge holder. And this you can't buy anywhere. You have to earn it through the game show. And then third place are some motivational gifts like a keychain and a bracelet and just things that help make you feel good about what you do. All right, so Blue, how's a puppy of yours? Stay tuned till the end. I will give you a pup date. He's actually right here at my feet. And I will show you the puppy in just a few minutes at the end of the game show. So if you want a pup date, stay tuned till the end. All right, so here we go. About 30 seconds before we start. So good morning, Nanda. Good morning, Yardley. Good morning. All right, so loosen up those fingers. Get ready for the question. Remember, the first right answer is going to win the most points. And if you change your answer, you won't get any additional points. But please remember that YouTube reads the questions in the order, or the answers in the order they come in, which may be different than what you see on your screen. Here we go. Question 1. A CNA is asked to remove a urinary catheter in preparation for discharge. The CNA knows that they, 1, can never remove catheters, 2, must be trained to do additional tasks, 3, must have a nurse present to perform this task, or 4, must do everything they are assigned to do without question. So what do you guys think? A CNA is asked to remove a urinary catheter in preparation for discharge. The CNA knows that they, 1, can never remove catheters, 2, must be trained to do additional tasks, 3, must have a nurse present to perform this task, or 4, must do everything they are assigned to do without question. Now this is a tricky question. And this actually is similar to a question that was on the state exam not too long ago. The right answer is 2. CNAs must be trained to do additional tasks. Now I'm going to put a caveat on this, okay? Some states do not allow CNAs to do certain tasks. But the term here is can never remove catheters. And that never is what makes that the wrong answer. Okay, so because in some states they can, and in some situations they can. So the right answer here is that CNAs must be trained to do additional tasks. You can be trained to do a lot of things as a CNA beyond what you're learning in class. And you need to be open to be able to learn new things. So unfortunately, nobody got that one right, but that's okay. I know we got the hardest one out of the way, but this was a similar question to what was on the state exam at one point. Number 2, a patient insists that he doesn't need a walker any longer. The nurse states that she requested a PT consult. This means, 1, that the patient must continue to use the walker, 2, that the patient must work with a personal trainer to build strength, 3, that the patient is non-compliant, or 4, that physical therapy will evaluate the patient. So a patient insists that he doesn't need a walker any longer. The nurse states she requested a PT consult. What does this mean? 1, the patient needs to continue to use the walker. 2, the patient must work with a personal trainer. 3, the patient is non-compliant. Or 4, physical therapy will evaluate the patient. So go ahead and lock in your final answer. You got about 3 seconds left. Here we go. Yeah, physical therapy. PT consult means physical therapy. This all goes into that being part of the interdisciplinary team. You need to be aware of all the team members and the roles that they have. So doctor, RN, dietitian, physical therapy, speech therapy, occupational therapy. You have to be aware of all of those different roles and what they're going to do for your patients. So that's what PT consult means. So we don't label people non-compliant. If you ever see that on the state exam, it's not the right answer because CNAs do not label patients non-compliant. And PT doesn't mean personal trainer. So, yeah, Blue, at the same time, you can't make them use the walker. Absolutely. Patients have free will. Absolutely. To Laura asks, do we need a high school diploma to be a CNA? I have a 7th grade certificate. I'll answer that in just a minute. Okay, question number 3. A patient requests an over-the-counter laxative. Which team member would need to authorize this request? So this is a team member question. 1, the CNA. 2, the pharmacist. 3, the doctor, or 4, the registered nurse. So a patient requests an over-the-counter laxative. Which team member needs to authorize this request? The CNA, the pharmacist, the doctor, or the registered nurse? So this question is all about understanding the role that each of these people play in the healthcare delivery system. So this is a chain of command type question. And you probably will get something like this on the state exam. So go ahead and lock in your final answer. You've got 5 seconds. Here we go. And the right answer is the doctor. The doctor has to approve all medication orders. All medication orders, whether they're over the counter or prescribed, the doctor has to approve. Now, the nurse can pass this on and can make a recommendation. But ultimately, everything must be approved by the doctor. So it's very important that we understand the role that each one of these people plays. The pharmacist will fill the order. The CNA will pass the order on to the nurse. The nurse will make a recommendation to the doctor. The doctor will order the medication, and then the pharmacist will fill that order. And that's how the healthcare delivery system works. Kanisha, I'm so sorry that you didn't get your other point. I do apologize. Anna came in first, followed by Kanisha, Anarol, Ashley, and Blue. I'm so sorry. The system sometimes gets a little glitchy. All right, question number 4. The care plan states that the patient should be dressed in long sleeves, but the CNA feels it's too hot outside for that. She should, 1, relay her concerns to the nurse. 2, dress the patient in short sleeves. 3, consult the chart to see if there's a reason for that order. Or 4, ask the patient what they want to do. So the care plan states that the patient should be dressed in long sleeves, but the CNA feels it's too hot outside. The CNA should 1, relay her concerns to the nurse. 2, dress the patient in short sleeves. 3, consult the chart. Or 4, ask the patient what they want to do. Oh, these questions are a little bit tougher for you guys this time. Yeah, I wrote them a little bit harder. About 5 seconds left. Go ahead and lock in your final answer. 5 seconds now. Yeah, answers all over the place. Okay, the right answer here is number 1. We're going to relay our concerns to the nurse. This follows your chain of command and keeps you within your scope of practice. The care plan says long sleeves. CNAs have to abide by the care plan. That's a fundamental rule. That's what we do. We don't get to decide to dress the resident in short sleeves, and we don't dig into the chart to figure out why. That's not our role. Asking the patient what they want to do, sure, that's part of patient preferences, but the problem is if the care plan is specifying long sleeves, there's got to be a reason for it. It's not up to us to figure out what that reason is, but there is a reason for it, and our job is to read and follow that care plan. So relaying the concerns to the nurse is the right answer. So, looks like, oh, I just missed the top one. I'm so sorry. Who came in first? I can't see. Anna came in first. Okay, question number 5. The CNA knows that maintaining a neat, clean, and orderly environment is primarily 1, housekeeping's responsibility, 2, the patient's responsibility, 3, the nurse's responsibility, or 4, the CNA's responsibility. So the CNA knows that maintaining a neat, clean, and orderly environment is primarily 1, housekeeping's responsibility, 2, the patient's responsibility, 3, the nurse's responsibility, or 4, the CNA's responsibility. So who is in charge of maintaining the patient environment? Go ahead and lock in your final answers. You have about 5 seconds left. Yeah, most of you guys got this one right. Yeah, it's a CNA's responsibility, absolutely. Now, housekeeping's going to help out with some of the heavy lifting, right? They're going to do the sweeping and the mopping and clean the bathrooms and all of that. But primarily, the CNA is responsible for making sure the patient's environment is neat and clean and orderly. So when you leave a patient, you should always look around. And a good rule of thumb here is to always leave your patient looking better than you found them. So when you're in a room, you should always take the initiative to straighten something up, whether it's the sheets or the bedside chair or the overbed table or the top of their dresser or bedside table, whatever. You should take the time to look around and make sure that environment is clean. Blue came in first on that one, followed by Nanda, Anna, Gorleen, and Darialine. All right, moving on. A patient complains that her call light has been going off for over 30 minutes. The CNA should understand, 1, call lights are secondary to personal care. 2, call lights must be answered promptly. 3, call lights are the nurse's responsibility. Or 4, customer complaints never matter in healthcare. So a patient complains that her call light has been going off for over 30 minutes. The CNA should understand, 1, call lights are secondary to personal care. 2, call lights must be answered promptly. 3, call lights are the nurse's responsibility. Or 4, customer complaints never matter in healthcare. We don't care what they think. Go ahead and lock in your final answer. You have about 5 seconds left. Here we go. The right answer here is 2. You guys mostly got this one right. Yeah, call lights must be answered promptly. They are not secondary to personal care. In fact, call lights are one of the main reasons that CNAs are circulating in the patient environment, is to answer those call lights, because the problem is in healthcare we tend to get jaded. Almost every single one of those call lights has something to do with, I want a blanket, I want a cup of water, I need to go to the bathroom, I need a snack, very mundane, routine, boring type of requests. The problem is that call light is really there for emergencies. So when that call light goes off, you have no idea whether it's a mundane, boring request or an emergency. So you must respond promptly. Hero Runner came in first, followed by Ashley, Anna, Nanda, and Anaral. Very good. Good job. Moving on to question number 7. A doctor is at the bedside and asks the CNA how the patient's bowel movements have been. The appropriate response is 1, usually once every 3 to 4 days with some difficulty. 2, you'll have to ask the nurse. 3, I'm not allowed to give you that information. Or 4, how should I know? So the doctor is at the bedside and asks the CNA how the patient's bowel movements have been. The appropriate response is 1, usually once every 3 to 4 days with some difficulty. 2, you'll have to ask the nurse. 3, I'm not allowed to give you that information. Or 4, how should I know? Go ahead and lock in your final answers. You've got about 10 seconds left. Yeah, this one was a little bit easier for you. This is all about understanding your role within the team. So the right answer is number 1. Yeah, we're going to tell them. Sure, the doctor wants to know how the bowel movements have been. we're going to tell them what we know. Absolutely. Now, this trips up some people because of HIPAA. HIPAA allows us to give information about the patient to other team members, those with a need to know. Now, if this was a doctor that wasn't treating the patient, obviously they have no need to know, and that would fall under HIPAA. But this doctor treating the patient at the patient's bedside is asking you for information related to that patient's care. You are allowed and encouraged to and have an obligation to give them the information that they're seeking. So good job. Most of you guys got that one right. Good job. So the life of Allie came in first, followed by Nanda, Carly, Anaral, and Hero Runner. I'm probably butchering your names, guys. I'm so sorry. A patient adheres to a vegan diet, but a regular food tray is sent. The CNA should, 1, insist that the patient eat what is provided. 2, speak to the dietitian about the diet order. 3, instruct the nurse to modify the diet order. Or 4, relay the patient preference to the nurse. So a patient adheres to a vegan diet, but a regular food tray is sent. The CNA should, 1, insist that the patient eat what's provided. 2, speak to the dietitian. 3, instruct the nurse to modify the diet order. Or 4, relay the patient preference to the nurse. Go ahead and lock in your final answer. Yeah, this is a little bit tricky. I'm seeing answers all over the place. Yep, a little bit tricky. So you got about 5 seconds left. And the right answer here actually is number 4. Yeah, we're going to relay that information onto the nurse. It's not our job to instruct the nurse to do anything. You have to remember that chain of command. The nurse is always over you. Okay, they're responsible for what you're doing. You're not going to instruct them to do anything. So that terminology absolutely disqualifies that answer. It's not our job, it's not in our role to speak to the dietitian about anything. That's not our role. Our role is to follow the care plan and relay everything back to the nurse. The nurse's job is to speak to the dietitian. So it's all about knowing your role. And of course, we're never going to insist that a patient eats a food diet that they don't agree with. So Anna came in first on that one, followed by Blue, Allie, Hero Runner, and Helen. Good job. We're at half over. Here we go. You have never performed a skill that you have been assigned. What should you do? 1, notify the nurse that you've never performed that skill. 2, ask another CNA to perform the skill. 3, refuse to perform the skill for patient safety. Or 4, perform the skill the way you think it should be done. So you've never performed a skill that you've been assigned to do. What should you do? 1, notify the nurse. 2, ask somebody else to do it. 3, refuse. Or 4, do it the way you think it should be done. So go ahead and lock in your final answer. You've got about 20 seconds left. This is a question you probably will get on the state exam. This is a really big topic right now. 10 seconds left. So the right answer here is number 1. Yeah, we're going to notify the nurse. Sure, we can do the skill, right? But if we haven't done it before, if we've been trained, but we haven't done it before, the first time we're probably going to be a little unsure. So having the nurse aware of that, and they can maybe assign somebody else to help us, or they can watch us, or give us some very specific instructions, or whatever the case may be, however they want to handle that. But it's your responsibility to let the nurse know. The nurse does not know your level of experience. They just don't. You're one of a million CNAs that they deal with, so it's up to you to let them know. So yeah, you would notify the nurse. Absolutely. Jamaican came in first, followed by Hero Runner, Guerline, Caryle, and Helen. Good job. Yeah, Blue, I know. And that's why that question is encountered frequently. A dietitian asks how well a patient you are caring for is eating and if you have any recommendations. You should, 1, tell them what you have observed. 2, explain what HIPAA means. 3, report them for incompetence. Or 4, instruct them to speak to the nurse. So a dietitian asks how well a patient you are caring for is eating and asks if you have any recommendations. You should, 1, tell them what you have observed. 2, explain what HIPAA means. 3, report them for incompetence. Or 4, instruct them to speak to the nurse. I know this one's tricky, isn't it? I'm getting a couple of different answers here. This one is tricky. Today's quiz is hard, isn't it? Yeah, so 5 seconds left. Go ahead and lock in your final answer. The right answer here is 1. Now, what makes 1 the right answer is it says tell them what you've observed. It doesn't say tell them your opinion. Notice that those are 2 different things. Telling somebody what you've observed, I've noticed that she doesn't eat meat. Every time the tray comes up, if there's meat on it, she doesn't eat it. Or I notice that she takes 2 or 3 bites and then refuses. Or whatever your observations are, those are absolutely appropriate to pass on if you are asked. This doesn't fall under HIPAA. This is another person in the treatment team. We're not going to report them for incompetence because they need this information to make recommendations. And you have more information on this than the nurse does, really. Blue came in first on that one, followed by Carlisle, Helen, Anaral, and Kanisha. So yeah, that was a hard question, wasn't it? But it's similar to what you might find on the state exam. A patient coughs often when eating and drinking. Her husband asks, is that normal? You would, 1, reassure him that it's part of the aging process. 2, request a swallow study to determine their aspiration risk. 3, thicken all liquids to prevent aspiration. Or 4, tell him the nurse is aware and will speak to him shortly. So a patient coughs often while eating and drinking. Her husband asks if this is normal. You would reassure him that it's part of the aging process. 2, request a swallow study. 3, thicken all liquids. Or 4, tell him the nurse is aware and will speak to him shortly. 10 seconds left. Go ahead and lock in your final answer. And the right answer is number 4. Yeah, we're going to let him know that, yes, we've made the nurse aware of it, and the nurse will be down to talk to them shortly. So this is kind of important, actually, because we don't want to ignore this, right? This is a concern. He's got a concern about this, and actually it is a concerning situation. But we want to let them know that, yes, we're aware of it. We have absolutely passed this information on, and further information will be coming from the nurse. We don't really want to get involved in that. We're not going to give them our opinion or our thought process or what we think is going to happen. That plays no bearing in this. We're just going to let them know that this has been passed on to the appropriate people, and they will be addressing it. So this is not part of the normal aging process, by the way. Be careful there. Life of Allie came in first, followed by Hero Runner, Nanda, Anaral, and Blue. Yeah, this is absolutely beyond a CNA level. Good job. 12. A nurse criticizes a CNA about an overflowing trash can at the patient's bedside. The CNA should, 1, report the nurse for improper conduct. 2, empty the trash can and ensure the room is orderly. 3, reprimand housekeeping for not doing their job. Or 4, demand a new assignment immediately. So a nurse criticizes a CNA about an overflowing trash can at the patient's bedside. The CNA should, 1, report the nurse for improper conduct. 2, empty the trash can and ensure the room is orderly. 3, reprimand housekeeping for not doing their job. Or 4, demand a new assignment immediately. What do you guys think? About 5 seconds left. Go ahead and lock in your final answer. Yeah, this is an easy one for you guys. We just talked about it. Yeah, it's our job. We're primarily responsible for this. So if there's an overflowing trash can, that nurse has every right and obligation to criticize you about it, because it's our job to make sure that room is neat, clean, and orderly. So we're just going to take it because it's ours, right? We didn't do the job. We're going to take the criticism for that. And we're going to empty the trash can and look around and make sure that room is orderly. This is not housekeeping's responsibility. And I need to make this very clear. An overflowing trash can is a CNA problem, not a housekeeping problem. Okay? And you're not going to demand a new assignment just because your nurse criticized you. If you deserve it, take it and learn from it. Blue came in first on that one, followed by Anna, Anarol, Hero Runner, and Nanda. Good job. Yeah, Blue, I agree. The nurse can empty the trash can as well. Absolutely. All right, so question number 13. Which of the following does not impact how patients rate customer service during inpatient care? 1, how many patients a CNA has to care for. 2, how long it took to answer call lights. 3, staff consideration and attitudes. Or 4, meal preparation, taste, and temperature. Be careful here. Which of the following does not impact a patient's customer service rating? So which of the following is not going to have an impact on how they rate the facility? 1, how many patients the CNA has to care for. 2, how long those call lights take to answer. 3, staff consideration and attitudes. Or 4, meal presentation, taste, and temperature. Go ahead and lock in your final answer. You've got about 5 seconds left. This is a hard question. It's actually 1. Yeah, they don't care how many patients you have to deal with. They care about themselves. And they're going to grade the facility on how long it took to answer call lights, how they were treated by you and other staff members. And they're also going to grade on meal, taste, presentation, and temperature. And this impacts you because if you're passing trays or getting patients down to a dining area, if that food is cold because you didn't pass the food properly, in a timely manner, if it wasn't the right temperature, if it didn't look appetizing, they are going to remark on that, and that is partially your responsibility. So Ashley came in first on that one, followed by Hero Runner, The Life of Allie, and Blue. Good job. Question number 14. A coworker states you are too slow and suggests cutting steps when performing skills because that's how it's really done. You should, 1, ask her to show you how she does things. 2, consult the policy and procedure manual and the care plan. 3, tell her to leave you alone and let you do things your way. Or 4, insist on following the steps you learned in training. So a coworker states you are too slow and suggests cutting steps when performing skills because that's how it's really done. You should, 1, ask her to show you how she does it. 2, consult the policy and procedure manual and the care plan. 3, tell her to leave you alone. Or 4, do things only the way you were trained to do them. So 5 seconds left. Yeah, answers all over the place on this one. Yeah. The right answer here is 2. A lot of you got this one right, but you may be performing skills differently than how you were trained to do them based on the policy and procedure manual. So you are trained to do things one way in class, but your employer is going to set up how they want you to do these tasks, the supplies that they want you to use, the manner they want you to use those supplies in, the order of certain steps. All of that is contained in the policy and procedure manual. You also need to consult the care plan, which modifies that policy based on the needs of the patient. So the policy and procedure manual and the care plan are there to guide you on how you need to do the skills. So the other CNA might be right, but we need to check to make sure. Ashley came in first on that one, followed by Blue, Hero Runner, and I didn't catch the next one. Sorry. Last question. A patient's care plan states that they are in PO, but the patient insists that they need water. You would, 1, give them water. 2, give them ice chips. 3, evaluate them for signs of dehydration. Or 4, pass the patient's concerns on to the nurse. So a patient's care plan states that they are NPO, but they insist they need water. You would, 1, give them water. 2, give them ice chips. 3, evaluate them for signs of dehydration. Or 4, pass their concerns on to the nurse. Go ahead and lock in your final answer. You got 15 seconds left. All right, I got some comments here I'm going to respond to in just a second. 5 seconds, last question. This one's for all the marbles. And the right answer is, yeah, we're going to pass those concerns on to the nurse. Absolutely. I don't care if they're insisting. If they're NPO, we can't give them water. You cannot give them water. You cannot give them ice chips. We follow the care plan. It's the care plan, the whole care plan, and nothing but that care plan. So the only thing you can do here is let the nurse know that the patient is insisting on water. That way the nurse can go in there and figure out what the next step needs to be. Maybe we can use some lemon glycerin swabs. Maybe we can get an order for ice chips. Maybe we can let them swish water in their mouth to get rid of that cotton mouth. I don't know what the right answer is here because it depends on the patient situation. But we aren't going to evaluate them for signs of dehydration, not our job. We're just going to pass this on to the nurse. Blue came in first on that one, followed by the Life of Allie, Nanda, Ashley, and Alucci. Good job, guys. Let's see how we ended this game show. Here we go. First place came in Anna, followed by Blue, Hero Runner, Anarol, Ashley, Nanda, Life of Allie, and so on. Well, we got a lot of people playing today. Good jobs. Okay, so for those of you who came in first, second, or third, you are going to send me an email to foryourcna@gmail.com. So foryourcna@gmail.com, you're going to tell me your screen name, your real name, your mailing address, and what place you came in. So Anna came in first, you're getting a card game. Blue came in second, you're getting a badge holder. And Hero Runner, you came in third, you're getting some motivational gifts. Anna, absolutely, you can pass your prize. Absolutely. No problem with that. So, Dana, congratulations on passing the exam. We are super, super proud of you. I am so proud of you. Trixie says, great, second failure, this mattered. I passed, thank you so much. Oh, congratulations, Trixie. See, perseverance does pay off. I'm so, so proud of you both. That's awesome. Okay, so Carly says, Carol says, tomorrow I'll pass my state exam. Yes, you will. We're going to give you absolutely the greatest vibes. We know you're going to do fantastic. And make sure you come back and let me know how you do. Okay. I did have a question a little bit ago about if you have to have your high school diploma. In most states, now this is state specific, I do want to preface that, but in most states, as long as you're 18 or older, you do not have to have a high school diploma to take the exam. So some states are actually 16 and older, some states are 18 and older. You want to make sure that you understand the rules of the state that you're in, because every state's a little bit different. But in most states, you do not, it is not required to have a high school diploma in order to test. Now, I do want to bring up, though, that some employers may require a high school diploma. So we do encourage you to go get your GED or, get your diploma. But keep in mind that it's not really specific to the test. It's more of an employability standpoint. Most states will allow you to take the test. So Hero Runner says, I will give my gift to Kanisha. Oh, thank you so much. Kanisha, make sure you let us know. And let's see here. Ashley says, how can I order the cards? Ashley, you can just go right over to our website, foryourcna.com, click on shop, and the card game is in the store. So you can order it on there as well. Let's see here. I'm now certified to teach continuing education classes to home care aides and CNAs. Oh, congratulations, Blue. That's awesome. Yeah, Blue, there is an age requirement for some employers as well. That's a very, very good point. I'm glad you brought that up. Let's see here. If Anna doesn't want it, can we have it? I'm in 4th place. Yeah, I've got to figure this out, guys. Send me an email. Those of you that let's see here, Anna, send me an email and just let me know that you're willing to pass on your prize, and we'll give it to the next person in line. So 4th place will get it. Okay. Trixie says, can we keep going? This really mattered. Oh, thank you, Trixie. Yeah, I know, Hero Runner. You have one before and you can't take. I know. I'm so sorry. Okay, Anna. So 4th place will get Anna's prize as well. I wish that we had more time. Unfortunately, we don't. I have to run. I have an appointment at 12. I wish we could continue, but go back and watch my replays. For those of you that don't know, I am, so let me put this in again here. So guys, those of you, work it out, let me know. Those of you who won or passed on your prizes, let me know your screen name, what place you came in, your physical name, and your physical address, and I'll get those mailed out this week. Yes, Blue Puppy. For those of you that don't know, I'm getting ready to redo my website, and all of these questions will be on the new website. So you'll have, I'm going to have literally thousands of questions on that website. Once it gets done, I'm working on it feverishly to try to get it up and running. And we will be publishing a book of practice questions as well on Amazon for purchase. But for now, go back and watch the replays of the game show. They are on my YouTube channel, but you have to go under the live tab because these are all live. So go under the live tab and watch the replays on that, and that should help you out getting ready for the test. Those of you that are getting ready to test, we are sending you great vibes. You're going to do fantastic. Those of you who passed, congratulations to you. Trixie, we do this game show on the 1st and 3rd Tuesday of every month at 11 a.m. I also live stream my classes. For those of you that don't know, on Mondays and Wednesdays from 9 to 1, when classes are in session, I live stream those. So if you want to review before you go take the exam, or if you just want to kind of get a different perspective on how CNA classes are taught, feel free to join us. It's live. It's free. Anybody can join and sit in. I'll give you the website for that. And I have worksheets and everything on there for free. So flcnatraining.com will get you the live stream for the classes. And I am live on Mondays and Wednesdays, 9 to 1 during class sessions. So Mondays and Wednesdays, 9 to 1 during class sessions. Next one starts on Monday, next Monday. And the 1st and 3rd Tuesday of every month for the game show. Jet, come here. Jet, come here. Jet, come here. Come here. Hold on. Pup date coming up. Let me grab him. He's being lazy. Hold on. Come here, Jet. Come here. Come here, sweets. Oh. Okay, guys. This is the newest puppy. This is Jet, and he is almost 9 pounds now. Say hi. Say hi. Isn't he cute? He's adorable. So Blue remembers my original puppy from last year. I'm going to show you her. And she and my rescue beagle got together and made Jet. So he is the newest puppy from the 2 that we had here. So let me show you. Annie, come here. Come here, Annie. Come here. Come here. So this is Blue. I'll show you the first puppy. Come here. Come here, Annie. Come on. Come here. Come on. Yeah. So this is Annie. She is 10 pounds, fully grown. Yeah. She is 10 pounds, fully grown, and she is my heart. She is the sweetest puppy in the world. And she and our Beagle mix got together and made Jet. So we now have 3 dogs, 2 of them puppies. Yes, it is a puppy problem. And I love every minute of it. All right. Yes, they're always discovering things. Absolutely. Let's see here. Can you postpone the state exam? Trixie, yes, you can. If you get a test date that doesn't work for you, call them immediately. If you wait too long, they're going to charge you. But if you get your test date, you know it doesn't work, call them. While they're on the phone with you, they'll work out a mutually acceptable date. But you want to make sure you call them right away. So yes, you can postpone. I hope you guys enjoyed this. If you did, please give me a thumbs up and let other people know about this. And we will be back in 2 weeks on Tuesday and have another game show. I'm getting ready for my class to start on Monday, so hopefully you can join us for that as well. So we're going to go ahead and sign off today, and until next time, guys, happy caregiving. Bye.